Okay. All right. Good afternoon, everyone, and welcome to today's NCHL Coffee Chat, Powering Sustainability in Healthcare, Strategic Energy Solutions for a Better Business and a Healthier Planet. I'm Christina Popicelli, the Senior Manager for Leadership Programs at the National Center for Healthcare Leadership, and I'm thrilled to moderate today's discussion. But before we begin, just want to share that this webinar is going to be recorded. Participants will be muted, but are encouraged to share their questions in the chat, and we can bring them forward to our panelists during and at the end of the call. We'll follow up with all attendees with a link to the recording as well as an evaluation of our programming. We welcome your feedback, and as we continue to evolve and grow in these offerings in service of advancing healthcare leadership. So as healthcare leaders, we're navigating rising environmental, financial, and reliability pressures. Sustainability is no longer aspirational. It's a measurable dimension of operational excellence, and it's a core strategy for resilience. Here's the reality of what's shaping our field right now. The US sector accounts for about 8.5%, 9% of the national greenhouse gas emissions, and the inpatient healthcare is the EPA's #2 commercial energy user. The policy momentum is real, even when voluntary. And disclosure of expectations is climbing. Climate disclosure mandates are expanding across multiple states and federal agencies, raising expectations for transparent reporting and risk governance. So these standards are incentivizing and are aligning. Joint Commission has the sustainability certification. CMS is decarbonizing and has a resilience initiative as well. And there's lots of funding opportunities under the IRA. But today, our panelists will translate that landscape into practical moves for cost control, risk reduction, energy reliability, and a culture change, so your organizations can deliver on the mission, margin, and community health. But before we dive into that, just a quick plug for the NCHL Fall Leadership Excellence Summit is November 17th and 18th in Chicago. I'll ask my colleague Malia to put the link to the event in the chat. Nearly 30 leaders will share how they're leading with clarity, empowering change, and leveraging AI and analytics to advance workforce and organizational performance. Registration closes soon, so be sure to check it out. And I want to now introduce our panelists. We're joined by a fantastic panel bringing perspectives from industry, supply chain, and facilities. We have Scott Helm, the CEO of American PowerNet and PowerSync. Scott leads 2 organizations at the forefront of sustainable energy and innovation. American PowerNet provides the wholesale to retail infrastructure that allows large electric users to procure, track, and deliver sustainable power efficiently and transparently. Through their new PowerSync platform, Scott is automating processes and competitive procurement at the ISO level for major companies, empowering them with the tools to build portfolios of cost-effective, renewable energy positions. This is supporting their commitment to 100% sustainable power while maintaining cost competitiveness and market agility. Denise Hodge is the process and sustainability lead at the University of Chicago Medicine. Denise began her career in finance before transitioning into process improvement more than a decade ago. She joined UChicago Medicine in 2019 as a supply chain process transformation specialist and now serves as the co-chair of the hospital's green team, Team Earth. Over the past 5 years, she's led initiatives that integrate data, operations, and sustainability to drive measurable progress in the organization's environmental performance. Arnold Sanchez Perez is facilities engineer and energy manager at the University of Chicago Medicine. Arnold oversees energy systems and energy management projects under the infrastructure and engineering department at UChicago Medicine, where he plays a pivotal role in advancing efficiency, reducing emissions, and implementing innovative energy solutions across complex academic medical environment. His energy expertise bridges the technical and operational aspects of sustainability in healthcare. Together, this group brings a powerful blend of industry, supply chain, and facilities expertise. We'll spend the next 35 to 40 minutes in the conversation, followed by audience Q&A. So feel free to drop your questions in the chat as we go. So let's get started. Denise, I'll first hand it over to you to give an overview of why this work is so important, for the broader sustainability mission, and then hand it over to Scott about the tactical approach.
All right, thank you, Christina. So why sustainability? Well, one of the key things is Christina mentioned is that healthcare is 8.5% of the total US greenhouse gas emissions. But beyond that, the global emissions across the world, the US is 27% of all emissions out of healthcare. We're number one in the world, not the place we want to be at the front. And these have impacts on health as well and our communities, especially our underserved communities. So if we think about this, we're seeing increases in allergens, changes to our vector ecology, which means we're seeing cases of malaria from mosquitoes in places we would have never expected it. Severe weather, extreme heat, air pollution, and these all come together to impact our communities and their health, whether it's via asthma, cardiovascular disease, and various other pieces. Not to mention plastics. We often use plastics as a patient safety perspective, but we're also seeing that plastics, microplastics, nanoplastics are having an impact on the health of our patients as well. It's been estimated that $249 billion of the disease burden is actually attributable to plastic. Now, the good news of all of this is that representing 18% of the US economy and 10% of the global economy, healthcare actually does have the power to make some changes. We can transform our communities and the markets and work with vendors, partner with vendors to make changes that will actually help us. So now University of Chicago Medicine is taking, varying approaches. But one of the ways that we do this is through our green team, which is Team Earth. So employees aligned to reduce, reuse, and recycle towards health. And we do have that in that order for a reason. Reduction is ultimately the best way we can move forward. Ultimately, our objective is to kind of coordinate all these. There's an amazing amount of work that's being done in our health system by a wide variety of people. And what we try to do is support those efforts and promote those efforts. Shout it from the rooftops what work is being done by faculty, clinical staff, supply chain, and facilities. So when we think about this, our goals, we're working on increasing education and advocacy efforts, sustainability reporting through both Practice Green Health and also creating some of our own dashboards, as well as targeted reduction and reuse efforts. So we're very focused on waste. One small goal we have is increasing items reprocessed by 15% in calendar year 2025. Greening the OR and aesthetic gas reduction of 4% across both inhaled anesthetics as well as nitrous oxide, and then energy and water reductions. There's huge amounts of factors that can go into that space, and I'll let Arnold talk more about that later. But you can see with the reporting, we are tracking some of these goals, and we are on track to make good progress because you can't fix what you don't measure. So we are a volunteer organization, but we are working across a wide variety of teams. We have an amazing sponsor in Eric Tritch, who is our Executive Vice President of Supply Chain and Support Services. And then I'm one of the co-chairs along with Arnold and recently joined by Dr. Lisa Vinci, who's been helping us to really impact that clinical space. Now I'll hand it over to Scott to talk a little bit more from an industry perspective.
Thanks, Denise. And I'll just point out, so the part that Denise was referring to when it comes to the energy component that she works with, where they try to reduce how much energy they actually use, that we refer to as the demand side. Our side is the supply side, where we focus on how to procure the power that you do need, and then how to track the attributes, whether it's wind, solar, et cetera, when you do purchase that, and then the subsequent appropriate reporting for that. Now, what you see here with PowerSync, that's a platform that we've recently developed. We've been in this business now for 30 plus years, where we take large buyers directly to the wholesale markets. The wholesale markets would be the ISOs like PJM, the New York ISO, ERCOT, ISO New England, et cetera. This shows you the infrastructure that we have in place where we're able to assist large customers access these wholesale markets directly. And so many of you might have tried to stick your toe in the water and do a PPA or VPPA and have been maybe unpleasantly surprised about just how expensive they are and relatively inflexible, even though it's an intermittent resource. You never know when the wind's going to blow or the sun's going to shine. So it's tough to take on a PPA or VPPA to meet your sustainable goals. So what we offer is a way to go out to the market and purchase blocks of power competitively. So you can you receive competitive, sustainable bids for parts of your portfolio, and then you continue to build that portfolio over time to reach your sustainable goals in the most competitive way possible. And so what we've realized over the course of time is that while all of us can now pick up our phone and buy any stock that we want, the largest, most sophisticated buyers of power are still picking up the phone and making phone calls and then getting email confirmations. And so PowerSync simply automates that for large, sophisticated buyers, where you can now take your purchases and ultimately have either empower your consultant or do it yourselves, where you'll be able to log in and request blocks of power to fulfill your load and have that delivered directly to your meters. And then this is simply an example of what the term sheet looks like. So since we're jumping to the wholesale market, it's not a retail contract. It's a simple wholesale term sheet where it's blocks of power for periods of time delivered to certain places, and then you blend those together over time. Thanks.
That's great. Thank you, Denise. Thank you, Scott. So let's kind of lean into the business case a little bit more. This is where mission and margin and reputation meet. So if healthcare is a 24/7, 365, the largest commercial energy users, like how do we turn that into a strategic advantage? So Denise, you did a great job in your intro sharing how UChicago Medicine is why it's important to UChicago Medicine to do this work. Is there anything else that you'd like to make sure that our attendees hear from you in terms of the influence and the long-term cost and the resilience and the reputation and why it's important to you and your team?
Yeah, so I think, the key thing that we all want to remember is that we are stewards of this planet and these resources, all of our resources, which includes our energy, all of our supplies, everything. So it's important that we be good stewards of those. And if you think about, most hospitals have a stewardship piece, right? We're looking at how do we do no harm? Well, if we're going to do no harm, we need to make sure that we're not doing harm through our environmental pieces as well. And when you talk about resilience, you always think about if you've got a reusable supply that's safe for patients, you don't have to worry when there's a shortage. So that's often an easy way to think about resilience and stewardship. And, a lot of our staff want this. They want to be doing more for the environment and they care, especially the younger generations that are coming up right now through medical school, right? They care. So they're looking at employers who are doing the work.
Thank you. Scott, from your perspective, how are the clients that you're working with, how are the hospitals and the healthcare systems, how are they looking at reframing sustainability? and how, as in terms of financial stewardship and reducing risk, um, how are
Sure.
they? Yeah, thank you.
Yeah, yeah. Well, there's the the hospitals have a lot of challenges these days, and certainly budgets are one of them. And so when you make a commitment um, towards sustainability and it includes energy, typically it implies there's going to be a premium to this sustainable energy. So now you have a tug of war between what the old budget was and what the new budget could be, or what sustainable power costs versus brown power, et cetera. And then you're trying to find the most pragmatic way to still reach your goals. Now, in the case of the Penn State University, who we've been working with for close to 20 years now, they had a 70 megawatt solar field that was built for them, and then every day we take title to that power and schedule it to the campus. Well, this was built maybe 10 years ago, and over the last 4 or 5 years, the value of those solar RECs, the SRECs, the solar renewable energy credits, has increased so much it's almost as much of value as the power. And so that is a couple $1 million worth, a couple $1 million a year. And ideally, you let those retire. That's how you that's what happens with these attributes. But in this case, we went to Penn State and we said, all right, it's a couple $1 million. Do you want that to retire that, or do you want to try and put it to other use within the campus? So as you might imagine, on a university campus, there was a lot of internal debate on just how to handle that. And what they ultimately decided was that they would sell their SRECs into the secondary market, go buy inexpensive Texas wind RECs in the secondary market, and then that meets their goals. But then they're taking the money that they made, the couple $1 million, and using that on campus on the demand side of the equation to reduce their total amount of energy, which is the most effective way to be green out of any of the ways, is just use less. So it kind of checked all the boxes for the university, where they didn't just have to let that dissipate and not get any value out of it, but actually reinvest it into the campus, but in a very productive way that assisted in reducing their overall usage.
Thanks for sharing that example. I can see how data and measurements and metrics are incredibly important when you're looking at this. I can't recall if it was during our moment together before the call started, but you can't, you don't know what you're going to be able to, if you don't measure, you're not going to be able to make any changes, I think is what you shared, Denise. But Arnold, I want to ask you, so what are some key metrics or performance indicators that best capture the return on investment and operational value of sustainable investments? So the work that you're doing, what are some important numbers you're looking to move up or down?
Yeah, so one key performance indicator that I can talk about that is pretty common in the energy field is the a facility's EUI, and EUI being the energy use intensity of a certain building, which that can be calculated by the total energy used in 1 year divided by the gross floor area of a building. And the reason that this indicator is important is because you can use it to justify an energy management project in a certain building that may have a high EUI. Um, and then additionally, UCM has recently completed a project to replace numerous steam traps through the facility to improve the overall EUI. A key metric and performance indicator that was used on this project was a simple payback, and this was estimated by calculating the anticipated therms saved over the next year by replacing these steam traps and converting it into units that are used to build the steam usage. So using the cost of the investment divided by the savings over the next year, we were able to calculate our simple payback on this project and found it to be less than 6 months. So that just kind of gives a couple of examples of some of the key metrics and performance indicators driving some of our energy management projects.
And just to
I'd,
ask,
I'd like to
oh, go ahead.
I'd like
Go
to
ahead, Scott.
just jump in there on a nuance with building projects, not necessarily with the steam, but other energy reduction projects. When you're looking at the simple paybacks that Arnold referred to, there's a way that you can extract more value out of what you're receiving from the electric. So if you get a flat price for electric at six, let's just say 6 cents uh, per kWh around the clock, and you do a lighting retrofit, now you're going to do your simple payback against that 6 cents. But the natural curve of electric every day is a high peak during the day, and then it's very low at night. So you could easily get the same price, but have it split up to 8 cents during the day and 4 cents at night. So since the lights are typically on during the day, now you get to use that 8 cents in the equation for your simple payback, and you actually make the project more attractive just by how you structure the pricing for your electric.
Thank you. Thank you both. Those formulas are very helpful. I think it helps those who are tuning in to think about when they're building the business case, what kind of formulas to consider when looking at the return value. I'm thinking following this call, in addition to the link, we'll probably put pen to paper and share those formulas back with our attendees today. That's really, really helpful. Thank you. So now that we've framed like the why this is important, let's shift into like how we do this. So how, hospitals, it can be very difficult in service of, change management to flip a switch on resilience, so to speak. So like, what are some practical strategies that we can do to move the needle? I'll ask you, Denise, to answer that question. So what are some practical strategies that hospitals can implement while maintaining quality and a safe care?
Absolutely. So I think, it depends on your hospital and what you already have, but there's a lot of low-hanging fruit out there. I think Arnold and Scott had mentioned LED lighting. That's an easy way. It is often a very quick turnaround from a savings perspective. But ultimately, looking at your waste and energy and taking a continuous improvement approach. Dust off your Lean Six Sigma books. That's my background. And actually think about how you can improve your processes, especially with waste diversion. Reprocessing is a great way to have a quick win that involves everybody across the hospital and is usually a pretty easy way. And I like to call it a win-win-win because there's usually cost savings involved, diversion from landfill, and you can lower your greenhouse gas emissions. And then also think about where can you use reusables and just look around, take an inventory of what you're using that's plastic that doesn't need to be. Where do you still have styrofoam cups in your supply closets? Think about where you can move and how you can do that. But ultimately, engage your staff. They know. They all are looking at it every day and can see what is driving them crazy. So work with them and they can they'll give you some of the best answers on what you can do.
Thank you, Denise. So Arnold, I want to ask about some of the technologies that you're using or that you're interested in that help advance this work. So what kind of technologies or partnerships in service of advancing power reliability that you're watching or using?
Yeah, so I can actually tie it back into kind of where I left off with my last answer. With these steam traps and the project that we just completed, the U Chicago Medicine has actually partnered with a company called ShopLogix, and we've implemented steam trap monitoring sensors on a lot of our critical steam traps. And what this allows us to do, it allows the medical center to gather real-time data on the status of a steam trap and address any issues as they come up through a software that they provide for us. as opposed to having to wait for the next steam trap survey. Otherwise, steam traps could be, failing. You could have live steam blowing through and not know about it until your survey comes around. So these real-time monitoring sensors are important. They can actually lead to a large amount of deferred costs if a steam trap issue is addressed in real time, as opposed to having to wait for the results, acquire the new steam trap replacement, and completing that project. So that's a technology that we've been using. Another partnership that currently exists at the University of Chicago and is being sought after at the medical center is the Snyder Power Monitoring Expert. This software is integrated with the steam and condensate meters to pull real-time data of our usage and allows us to develop trends from historical data that is stored. And then there's also the ability to integrate this system with key assets to increase visibility on power reliability and energy sustainability.
That's excellent. Thank you. Just to give some of our attendees an idea of maybe the scope of the work, I want to ask you about, and I'm sure you have the exact number of steam traps that you have in your organization. So how many are we talking here?
Yeah, so the ones that we know of are over 2,000. And the software that we're using through Affiliated Steam and then ShopLogix is helping us with those monitors that give us the data back. We have all of them logged into that software. And then we have about 368 of the steam traps with monitoring sensors on them currently.
Thank you. Thank
Yeah.
you. Scott, I want to hand it over to you for this next question. Given the increase in climate-related disruptions, how can leaders anticipate to handle grid instability and integrate resilience planning into capital and facility strategy?
Well, that implies trying to bring some of the capabilities of generating power on site and not be fully reliant on the grid, because so much of that is out of your control. If something goes down, you're not in a position to do it. So many hospitals have backup power, so you want to make sure that is always kept. Always tested and running well, and you also would want to see if it can be upgraded or if it qualifies to run other than just emergencies, because you want to be able to also help reduce your costs when prices are spiking. So there's a lot of factors that are going in. You mentioned the weather, but also the demand from all the AI factories and data centers is really putting stress on the grid as well. So there's a lot of competition for all the generation that the U.S. can currently muster. That's not going to go away anytime soon. The queues to build new generation are across the country in general 3 to 5 years. So there's huge demand for load. You want to be proactive in getting your power. If you're making these commitments, you might have heard of Scope 2 reporting. Depending on what type of commitments you make, you might have those standards that you're required to meet, and that's something typically where you need to show a clear chain of ownership of these renewable energy attributes. And when it comes then to those attributes, there's two types. There's the RPS, the Renewable Portfolio Standard. So if you're currently getting power, baked into the power price that you're getting from your supplier is what they're obligated to purchase on your behalf that is renewable. So if you understand what that is, you don't necessarily have to start at zero. That's, different companies want to measure it different ways. But the facts are you're already purchasing a percentage, probably in the 10% range, plus or minus, of renewable power for your usage. And then the rest becomes voluntary on top of that. But there's no reason you can't combine both of those to achieve your goals.
Thanks for sharing that. It definitely requires an adaptability to handle unplanned change in a structured way, so to speak. So to be able to plan for what's going to happen. So I appreciate that insight, Scott. Thank you.
There's a lot of moving parts, and you have to try and figure out the best way to fit them together while you're actually moving.
Yeah. Denise, I'm going to hand it over to you to share a little bit more about your journey with Team Earth, potentially about embedding sustainability resilience into daily operations and governance structures.
Thank you. So I think the key piece of this is exactly what you said around talking about daily operations and kind of meeting in the middle from the grassroots up and then the leadership down. So part of what we've been doing is we've actually started to embed sustainability into our Elevate 2035 strategic plan. So that's that leadership down. So that's kind of highlighting that this is important across the thing, but then it's also about bringing all of our staff along with us and getting them interested and excited in what they can do and how we do that. So by pulling it into the daily operations, you have to make it part of their workflow. Like a silly thing that sounds so simple, but made such a huge difference to us in our numbers is reprocessing in the ED. So nobody in the ED has time to be wandering to a soiled utility room to put something in a bin. So we put bins in each of our ED bays so that once they use the pulse ox off when they're discharging their patient or transferring them, they can just put it in the bin right there and there's no question, and it's much easier for them to do. So I think those are kind of the key pieces when you talk about embedding it. It's really making it kind of part and parcel with what they're doing and making it easy for them to do it, as well as creating a culture where people know that this is stuff is important, and then understanding how they can be a part of it.
I like that. It kind of takes into account like human factors engineering, where you're also looking how to create the environment where the right choice is the easiest thing to do, and it's not the hardest thing to do. That's fantastic. That's kind of leads into our the part of the discussion where we want to look at building culture and change management, because even the best plans fail, and without people to be able to think, discern, work together, collaborate, and problem solve, we've got a big problem. So I want to ask if you can share a little bit more about the work with making it not just like another thing. You mentioned at the beginning where you're engaging those who have an interest, who obviously may not report under supply chain or in facilities management, but maybe in the clinician side of the house. How do you cross-pollinate? How do you guys work together to solve these problems?
Yeah, so I think the thing I want to note is that most staff actually want this. They want to help. They're excited about it, but you need to make it easy for them, and you need to make it accessible. So a lot of them may not have like the project management skills. So that's where like I'll come in and just support. Not like I'm not doing the project for them. I'm just kind of like giving them views and how they can do it. But often it's great because find those champions, get them excited, and they will come up with the most creative ideas. We have a nurse in our OR who actually created a waste segregation game that literally so they have teams that compete with taking pictures of different items and making sure they can put them in the right bin. So they've made it, like I said, gamify it, make it a competition, and they get really, people get excited about it. And so it becomes something that maybe, in some cases is fun, but also it's part of the culture and it's linked to stewardship. Again, I'm going to go back to that. Stewardship of our resources and stewardship of our planet. That's what hospitals, are care a lot about. And so linking it back to that.
Thank you very much. Just another plug, if you have any questions for our panelists today, feel free to put the question in the chat, and we can bring it forward. So just another plug there. Scott, I want to ask, what role do senior leaders or executive leaders have in terms of the sponsorship of this work in achieving measurable outcomes? So when you're working with senior leaders or executives with your clients, what role do they play?
Well, I would say that it really starts with them. Anytime we go to a new organization, one of our first questions is, what's your definition of sustainability, or what's your definition of green? Virtually every company has a different definition on what they consider green or sustainable. That starts at the top. And so usually that definition, that internal definition, is idealism mixed with a lot of pragmatism. That CEO has to figure out how to be a excellent steward at the same time as meet his budget and make payroll and make investments in new equipment, et cetera. So there's a lot that goes into that equation when they come up with a definition, and then you try to figure out, okay, where's the low hanging fruit to get you closer to your goals, and then you start building from there. In the case of the commodities where we work, a lot of times it's not readily apparent. It's a matter of trying to hit singles and always kind of chip away at the goals from the supply side while you're assisting the demand side.
That's great. That's great insight too. What's your definition of green? What's your definition of sustainability? And then go from there. Yep. Arnold, I want to ask you about your experience of working with teams and collaborating between facilities, supply chain, and the clinical teams. What's an example of what it looked like to produce the measurable energy or cost savings that you mentioned before?
Yeah, so you know, I wanted to talk about something that we're currently working on, and it's still really early in the in its stages uh, of development, implementing, and commissioning. We're working on a project to set back the amount of air changes per hour in non-trauma ORs during off-peak hours. And this was something that was kind of brought up by the OR staff, their interest in trying to bring back some of these air changes. So this effort requires a lot of collaboration between facilities, OR staff, infection control and prevention teams. We're expecting to see a large difference in the overall electricity usage once this project has been implemented. Um, and so that's just one of the examples of things that we're doing. There's also projects that require close collaboration between facilities and clinical staff. And these could include the replacement of the steam traps that we talked about earlier. Some of these steam traps are in the ceilings above the ORs, some of the clean areas, the sterile processing. It's close collaboration with the clinical staff to say, hey, when can we do this work? Should it be done overnight? What type of cleaning procedures should we follow? So those type of things, along with window replacements, air handling unit replacements, and much more that will lead to measurable energy and cost savings.
That's great. Thank you.
Yeah.
Thanks, Arnold. Denise, I want to ask a little bit more. Congratulations and kudos to you and the team and the successes that you've had with Team Earth. Can you share some advice or offer leaders some motivation or inspiration on how to launch or reinvigorate potentially like a sustainability initiative that they've had, like a green team, so to speak, in their organization? What kind of advice that would you give to them?
Yeah, so I think we've had to reinvigorate a couple times, and I think it's important to start small. So you saw like I have these beautiful charts and measures, but it took us a while to get there. And so, starting with those small successes, like Scott and even Arnold had talked about, where it's the little wins and celebrate them, get excited about them, share them in newsletters, and give credit to the staff that are doing the work and doing that, because there's nothing that feels better when you get a good, you get recognition for something that you care about and you're doing, and find those champions. I guarantee you, if you look, somebody's already doing the work. There is somebody who's already on a unit being like, guys, stop putting that in the garbage. Put it over here. Find them, gather them, and then look at ways to gamify it. Nothing will get people more excited than a competition. So find little ways to do that. And then you can start with a game. And then as you see who's kind of like the big people who are pushing for it, that's where you find your champions at.
It never ceases to amaze me the creativity some folks have, and where they'll come up with different ways to like create art, out of some like the caps on the vials and things
Yes.
like that. Like they'll see artwork will come out of that, or some other sort of things where folks are being really creative. But kudos to the leadership team to kind of inspire and motivate and encourage that, instead of like not turning up the pilot on that flame of
Yeah. Just
engagement.
a funny story on that. If you looked at our slide about Team Earth, you'll have seen that weird little trophy that's in the middle, because we do that for
Yeah.
all of our whenever we have, Earth Month for April. And that is actually made out of expired medical supplies. So we had an artist in one of our units who put that together for us and created that. So those are some Foleys and catheters in there. Clean, of course, unused.
Expired, I'm sure.
Yeah.
Thank you. Thanks so much. Okay. So looking ahead, Scott, you mentioned AI and the impact on energy consumption. I mean, really, like the ground is like shifting under our feet every day. It feels, with different tools that are coming up, different incentives to use or not use. So I'm thinking about how leaders should, prioritize the next 12 to 24 months in what they should focus on. So with the evolving U.S. Policy commitments and carbon neutrality targets, you mentioned Scope 2 reporting and tax incentives. How are these shaping the sustainability, like the planning in healthcare?
I think it is having a big impact right now. Part of it is that there is still not a lot of certainty, and that's when you get your most aggressive investments, when there's certainty. You mentioned about the IRA at the beginning in your intro, and a lot of the IRA incentives have been rolled back, and so it causes uncertainty on whether you can make that investment. Now, one thing that has happened is that a number of states have stepped in to try and fill the role of what the federal government was providing in terms of incentives. Many states already had incentives, and you could stack those on top of each other. Some of the states have recognized that they needed to basically jump in place of the federal government to keep some of these projects alive, and that goes for battery storage projects. I think batteries might be one of the ones that is less unscathed than, say, solar or wind, but battery, many times you can bring that on site and you can be a little more, batteries give you a little more flexibility because uh, you can change the time and parameters on when you're going to use it and when you're going to store. So that whole technology area, uh, because the technology is rapidly improving so much as well, that's still a pretty attractive area to look. But it's something where you need to go out and have companies come in and provide you what their best offers are. Because the landscape is changing so much, even if it didn't look good last year, it might look good this year. You know, tariffs come into play. There's new manufacturers who are qualifying here in the U.S. every day, where maybe they weren't available a year ago. So it's a very dynamic field, and so uh, don't just assume that what you learned last year, everything stayed that the economics stayed the same as they were last year, and that's what they are this year. You got to keep going out to the market to find out because everybody is attacking the market from different angles.
Thank you. Thanks for sharing. I've asked Malia to share an updated Inflation Reduction Act sheet. In preparation for this call, I had pulled up one, and I'm not sure that it's the most current one. So to your point, we want to make sure that we've got the most current information. It's changing. There's things that have impacted those changes, but it's important to educate yourself and be aware of what's happening, the external factors and legislative changes that are impacting. So thank you for pulling that up, and thank you, Malia, for sharing. We'll be sure to include it in the post-call resources as well. So let's see, any questions we've got? Denise, we've got a question for you. How does U Chicago Medicine view its role as a leader in advancing environmental sustainability?
So I think we view ourselves as somebody who is just trying to do the right thing. We are, again, stewards of good resources in our planet. I'm sorry if I sound like a broken record, but I feel like it's one of the really important things. But also, one of the things I'm really proud of is how much we share with other health systems and how much they share with us. There's no competitions in this. Okay, other than the games to win the pizza party. But as far as across health centers, this is all about sharing best practices, educating each other as best we can, wherever we can, because we're all in this together. Did that answer the question?
Absolutely, absolutely. I've asked Malia to share another link that goes to a pledge from the Department of Health and Human Services, which again, it's a voluntary pledge, but it's something to consider to take a look at and see if there's any alignment or opportunity to pledge support.
And I will say too that if there's concerns about, some of the external pledges get a little dicey, looking at the Joint Commission is another place, that sustainable healthcare leadership is another great way because you have a little bit more flexibility in what you're signing up for. And then also just, again, sometimes reframing it into stewardship or resilience is a great way, but to keep the work forward.
Thank you very much. We'll pull the Joint Commission one also to share. Thank you for pulling that forward. Let's see, Arnold, want to just ask somewhat of a final question for you to share. How do you see innovation, including AI and smart energy systems, transforming the healthcare sustainability landscape?
Yeah, so I can't speak too much on AI, but as far as the smart energy systems, the U Chicago Medicine is actively exploring different systems that can enhance the operations, maintenance, and management of energy. One of these systems includes the PME system that we previously discussed, and its ability to act as a smart energy system that monitors key assets throughout the medical center. to improve reliability and energy efficiency. Some others that come to mind are even just the steam trap monitoring sensors. I think I stated that we have about 370 out of our 2,000 traps being actively monitored. As we look to expand that program, that gives us more visibility on any costs that we might be missing out on, any savings that we might be missing out on, as far as getting some of those issues addressed in a proper manner. So.
Thank you. Thanks so much, Arnold. We've covered strategy, operations, people, policy. To close out, I'd like to ask each of you one must do that each of you recommends to embed sustainability into long-term strategy. What's one key takeaway that the attendees can take with them? I'll hand it back to you, Arnold. What's one piece of advice that you would offer to anyone tuning in today?
Yeah, so I think one piece of advice I would offer anybody looking to try to make a difference in this um, type of aspect at their health care center, I would reach out to people in facilities. See if there is an energy manager or a position such as myself, facilities engineer, that's already working on some of these projects, and bring some things that to their attention that maybe they're not aware of. Like we spoke about the ORs wanting to do setbacks in their air changes. That was something that was brought up that I didn't know was, a potential large savings. And when that was brought up, it was like, yeah, go ahead, start looking at that, start developing the project, talk to these key people. And that really like drove it. So, it starts from just somebody sparking their interest, reaching out to the right people and getting stuff like that moving.
Thank you. I'm excited to hear your story and the outcomes, the positive outcomes that you've had so far. And I'm really interested to see where your story goes, and the research and evidence that you all will continue to pull together in service of this work. So keep it up. Great job. Thank you. Scott, I'll ask you if there's one piece of advice that you would offer to healthcare leaders.
Well, one is to stay abreast of current events and how that is going to have an impact on your facilities. And then understand what's the relationship, what's unique to your facilities, the relationship between the demand side and the supply side. And then that gives you, with that information, it gives you a chance to kind of anticipate where you should be looking to save resources, save money, put your efforts into retrofits, et cetera. So if you have that 30,000 foot level picture and how it affects your facility, that puts you in a great position for coming up with a effective strategy.
That makes sense. Thank you. Thanks, Scott. Denise, what's one insight or takeaway that you hope our audience carries with them?
So talk to each other. So you're all on this call, so it means you all care about this in some way, shape, or form, or are interested in it at the very least. So talk to your staff and talk to each other. There are so many ideas out there, and maybe some of the ones we shared are right for you, some of them aren't, but I guarantee you there's 1,001 ideas. So just go talk to people and they will share and they will get excited about it. You maybe have to prepare to have a little bit longer conversation than you expect.
Thank you very much.
Thanks for having us.
Yeah. Well, no, thank you. Yeah, this was very candor, but there's also concrete examples that you shared. So we really appreciate that. I want to give a special thanks to U Chicago Medicine for their leadership in this space. Thank you for being a USCIP member here at NCHL. Also, special thanks to PowerSync for coming and joining this conversation and sharing the great work that you're doing. Keep the momentum going. Are some things that came to the top for me today. Measure your baseline, find the champions, and make the early wins visible. Thank you for joining today's session. We want to make sure that if you have any additional questions, visit us at nchl.org. You can contact us at info@nchl.org. You can also scan the QR code that's on the screen now to learn more about our leadership programs. But thank you very much for being a part of this conversation. Reach out if you have any questions. We're happy to help. Thank you all, and be well.
Thank you.
Thanks.
Thank
Bye.
you.
Bye.